Clara Norton Fowler, whose pseudonym was Christine Beauchamp, was born in 1873 in Massachusetts. She faced a profoundly traumatic childhood, experiencing the loss of her newborn brother at the age of 7, followed by the passing of her sister Bessie and her mother when she was just 13. Additionally, she faced severe domestic abuse from her father, which eventually led to her running away from home when she was just 16.
She was one of the first cases of DID, dissociative identity disorder, which is a mental condition in which one individual has multiple personalities that have their own behavior and take control over the host throughout different periods of time. Morton Prince, an American psychiatrist who specialized in neurology and abnormal psychology, took interest in her mental illness and began to study her at the age of 23.
He discovered that Clara had 3 personalities: Ms. Beauchamp, Sally, and B4. Ms. Beauchamp, also known as B1, was called the Saint. She was very timid, considered well-educated, and loved to read. On the other hand, Sally, who was also known as B3, was called the Devil. She came off as a tomboyish woman who loved to flirt and be sensual. Finally, there was B4, who was a very angry and selfish person. Though Sally called her the Idiot, Prince deemed her the Woman, as he believed that she was the real Clara.
In the end, Prince helped Ms. Beauchamp find a cure for her DID through mending her personalities all into one. He accomplished this through hypnotizing them and finding a way for each personality to acknowledge that they were in fact the same person. In his published case study of Ms. Beauchamp's personalities, he annotates this process, writing that, quote, "We talked it over and I pointed out to Sally that if her discovery should turn out to be true, then the memory of B2 must be the same as that of B4, and vice versa."
Beauchamp's therapy involved mainly hypnosis, but in modern times it likely would have involved both medication and psychotherapy. Her flirtatious demeanor towards her therapist would have also violated doctor-patient guidelines in modern times. She was also flirtatious with other women, which was viewed as a symptom of her multiple personalities, but today would have been recognized as bisexuality rather than raise concern for diagnosis. To this day, there is no cure for DID, but the most effective approach would be to unify each personality with the original identity.
Ms. Beauchamp ultimately married Dr. George A. Waterman, a psychotherapist who was the assistant of Morton Prince. Her accomplishments after therapy remain unknown and no record of her death exists. While it's unfortunate that we know so little about her, we appreciate her contributions to the understanding and treatment of future DID patients.
Ms. Beauchamp is both fascinating and insightful. However, it is just one piece of a much larger narrative. We implore you to consider the following questions.
How did societal expectations of women during the time of Ms. Beauchamp influence the diagnosis and treatment of her mental health?
In what ways does Ms. Beauchamp's case reflect the historical use of psychiatric diagnosis as a means of controlling or silencing women?
How do modern interpretations of Ms. Beauchamp's condition challenge or reinforce historical narratives about women's mental health?
Unfortunately, we believe that Ms. Beauchamp is a harrowing example of how women can be taken advantage of in the psychiatric industry, with her gender sadly dictating the standard of the care that she received.